Hi, I'm John Freitag. I'm with All American Hospice, and I'm here with Jim Turner. He's the owner of Interim Healthcare. And Jim, how'd you get into healthcare? How did you get into owning your own business?
Well, let's see. I like most of us, started out of college. I joined a big corporation. I joined Abbott Labs, the Ross Lab division, and began selling medical nutritional products. And that brought me very close to the home infusion business, where we were selling into a lot of mom and pops. And I was recruited by a startup then. About 8 years into the company, but still a new industry. A company called Caremark Home Healthcare of America, which was an outstanding organization, very value-oriented, and it taught me a lot about how to add value to the service model in healthcare.
That's a big thing, though, adding value. Like, right? I mean, what's the point if you're not going to bring value to a person? They're not going to want to listen to you. They're not going to want to hear what your product does, right? So it needs to be more than just here it is.
Absolutely, and I could never just do something to make a buck. I'm just not built that way. It's not how I was raised. So it was gratifying. It was quite impressive to see how Caremark worked and what they did to add value to the process. And by doing so, they created an incredible market share in a rapidly growing business such as the home infusion, what we called then as the high-tech infusion business. And to the point where Baxter Healthcare came and bought us out. And rather than taking Baxter's name in the business of Travacare, Baxter maintained Caremark's name. And that's actually why it exists today under Caremark. You see with CVS, it's the same Caremark entity. Okay. Baxter spun them off, spun Caremark off when it realized that the hospitals were competing more and more in the home care business. So it was counterproductive for them to have competing entities in some of the major markets.
Yeah, and we've seen how that went. They're pretty much just have their own, home care. It's a continuum of care.
Absolutely. So after Caremark was spun off, I ended up staying in the infusion business. We started a couple of companies. The last business I started was called InfuScience, and we grew that to about $70 million, and that was bought up by another company. And I was done with the corporate thing at that point. And I wanted to stay closer to home. My kids were in college. My one son was playing college baseball. And my last year in the corporate world, I got to see 1 out of 60 games.
Wow.
So and that's when I bought this franchise and learned what it was to be a small businessman.
That's great. And you get to have a better work-life balance and everything too. So
Absolutely.
And now you work with your son.
Yes. Actually, both my boys work for me now.
Oh, wow.
JJ is a telemed and a business development rep. And my youngest son just got out of Temple with a degree in psychology. He's a patient advocate.
That's great.
We use a patient advocate to just help folks get into the rhythm of alternate site care and as a resource for stuff that's not so clinical, but maybe still quality of life oriented. And Scott, for example, will work with our telemed folks to get them up and running on the portal and understand how to use it and also interact with the community. So
for someone who's never worked with telemedicine, how does it work? Could you give us like a breakdown of it?
As a few of my doctor friends who really created these programs will be quick to point out, telemedicine has been around since the telephone existed. I mean, we've all called doctors on call, and that's always been an element to the program. But up until probably 20 some years ago, it really wasn't a dedicated technological part of the care continuum.
So the docs would just take your call, you give them some symptoms, they tell you what to do, and they weren't billing for it or anything like that.
Exactly. There was no way to bill for that. The U.S. military got involved first with telemedicine, with radiology, and sharing that sort of technology for their own use across military providers. And then over the last 10 years or so, the current technology has come to fore, where you see Teledoc and the likes, where you've seen, I guess, mostly payer-based initiative. I mean, Teledoc is, their CEO is the ex-CEO of Empire Blue Cross Blue Shield. And when he created Teledoc, he created a model for payers to sub out, for self-insured employers to access and keep their employees more well and more able to work, whether from the home or from the office. So the teledoc model is a licensed doctor in any state, as long as you're in that state, as you, from your state. You call the doctor, they go through some background questions, and you get a diagnosis. The doctor can write a script for many things, not for anything of a opioid or
so no narcotics, right? Okay.
And narcotics, but just anything else for certain elements. And it's really taken off. It's quite a convenience, certainly for those employers and their employees. We have some folks in our home healthcare community here who I've spoken to who have used those sort of programs for their family.
Yeah, and Jim, could you tell us a little bit of how far it's come? I know there's been a little bit of reluctancy to use it, but there's been so much advancement in the technologies, like we talked about, from going from a telephone to now you have all this specialized equipment in someone's home for a doctor to be able to monitor them.
Absolutely. You have an entire spectrum of opportunity to get involved with telemedicine, starting with just the simple teledoc thing, and that would be something you can make available to your patients at home and just help them to access that sort of a platform. Or you could work with a specialty company like SmartCareDoc, a company I've worked with in the past, to provide services that include medical devices in the home, where you can listen to the heart. You can use a light pen to take a picture of an ear, nose, and throat issue. You can look at any point on the body. You can take a picture and send it to another lab, another physician. These options are continuing to expand. As anything digital can be attached to the computer, you're going to see that happen. GE has built a ultrasound machine.
Wow.
And so.
And you're talking about stethoscopes and things like that. They could have.
There's a stethoscope. There's any number of devices. Again, as long as it can be digitally programmed, it can go through the system. It takes a little bit to do it, but you're going to have to. It's certainly worth it for the benefit of the patient.
Sure, and I know a lot of home care companies are utilizing it to decrease return to hospitalizations and things like that, right?
Absolutely. With the COVID-19 actions taken, you're also seeing doctors now whose reluctance was pretty significant, mostly due to the lack of reimbursement. It's terrible to say, but it is in fact.
Right. That's certainly giving it a shot in the arm, right? So people are now doing a lot more telemedicine.
We have folks now that are calling us up and saying that they want to do it. I've been speaking to them for 3 years about it. No, hey, we'll get to it. Now it's, can you be here yesterday? So that's kind of a chuckle. But it is, the COVID-19 crisis has simply shed light on the fact that this sort of access is critical for people that either don't want to get around in the alternate site or they cannot get around.
Right.
And this model really does fit the bill for that in terms of patients that are reticent to leave their homes. They're worried that they're going to be exposed. So bringing one person in with a device and with a setup to be able to see their doctor, and they can see their primary care doc, they can see a specialist, they can see a dermatologist, whoever they would like to see, as long as we have consent from the doc on the other end.
Right.
And we'll get them set up.
It's a shame that it took a pandemic for this to all come together. But I mean, because there's always been a need of, patients who are homebound who need to see a doctor, aren't able to get out. This certainly takes the strain off of them and their families to get them to a doctor's office. Sometimes
Absolutely.
it's.
Absolutely. And the pandemic influence is wild, but it comes in the face of, this came from CMS, who's not always known for making quick or efficacious decisions. In this case, they did. They did the right thing. Certainly, they're not reimbursing for technology, but that's fine. They're reimbursing for the process and the docs to actually make this happen. So we have a patient-based attack.
Yeah, it's been amazing how fast they can move now. And I think it was Seema Verma from CMS who said now the genie's out of the bottle, right? So
yeah. And let's see what happens next. One of the things that I think is most important is that when you do get involved with telemed, that you make it as easy as possible for the consumer, because they're the last line now. And honestly, it's been impressive to see how folks have picked it up and embraced it as they've been faced with the option. Now, patients too have been reticent, and now they are opening more and more because their doctors are. I have a patient in Philadelphia we've seen 4 times in the last 4 weeks to get through a specific incident that her doctor had no desire to get involved with telemedicine up until 6 weeks ago.
Yeah.
And then I got that text, "Hey, Jim."
Right, right. Yeah, so now the docs are more on board, the patients are more on board. Is there any other hurdles that you need to get over? Anything else to really get telemedicine into the mainstream?
I think that payers still need to take a look at it and embrace it. Okay, how are we going to reimburse for the technological aspect of it? If I enable a physician to make a connection to his or her patient, then as a home health provider, I should be able to get some sort of small reimbursement for that. Currently, we're not charging anyone for it. We're using it as a loss leader, and I'm happy to do that because, quite honestly, it's a lot of fun to use. And I think it's an appropriate augmentation to the home health product line.
That's an important point, Jim. And I actually haven't read much about it. I've seen that doctors now getting reimbursed for like telephone visits and for telemedicine visits, but I didn't think about the providers such as yourself.
Right.
So have they made any advancements in legislation or just payer changes?
No, we've had some private payers acknowledge that it's an issue that should be addressed, but like so many, they'll address it when they have to. At this point, they don't have to.
Yeah.
I mean, I remember when I was at Caremark, and Caremark came up with a tremendous idea to pay physicians for their cognitive labor for oversight of patients at home. An ID physician, for example, spends maybe an hour or hour and a half per week per patient managing their labs in the alternate site. And they don't get any compensation for that whatsoever. We came up with a time management program, took it to a big payer in Harrisburg and said, how about you reimburse doctors at this level for the cognitive labor? And their director of contracting, I was with an ID doc at the time, actually, I was the general manager at Caremark out there. And the guy closed the door and he said, you know what? We're not going to do that. And he looked right at the doctor and he said, you know why, Ernie? He said, because you're going to do it anyway. You're going to take care of that patient regardless of whether I pay you or not.
Right.
And he was absolutely right. It was a very educating, that was an illuminating day for me, and very disappointing day. But you know, that's unfortunately how the payer mechanism works.
Right.
When they're forced, CMS was forced with an imperative to make a decision recently, they made the right decision. And I think,
quick.
Pardon me?
And a quick decision.
Yes. And again, that's not their hallmark. So
right.
Kudos to CMS for moving forward like that.
Right, that's a shame. So how could someone learn more about telemedicine, or how could they get more involved?
Please have them give me a call. I'm working with a telemed distribution company right now to try to set that up and make it more available to more players. And working with one doctor's group out of Maine right now who built a patient web portal that I think is quite impressive, that we use in our practice for any patient who would like to have access.
Yeah.
All they need to do is reach out to me. I would love to direct them in the best possible way.
Yeah, I mean, I certainly think it's really important, especially for physicians with large practices, that they're able to reach all their patients. It's easier for them. It's easier for the patients.
Think about it, John. Rather than going to, and I'm not putting down teledoc, these are great, convenient tools, but rather going to any random doctor to talk about your headaches or your runny nose or whatnot, being able to get your own doctor on that, particularly if you're dealing with a child, get the pediatrician on that, who knows the background, who understands that individual. To me, that just seems like it makes more sense if you're going to have a telemedicine visit that you're paying $50 for. Because a lot of the fees do come out of the patient's pocket on the provider side. Even though they'll allow it to happen, they're expecting that basically to come out as a copay.
Okay. Yeah, and you get that continuity. You're having the doctor who you've been seeing, you're not seeing the doc over at the urgent care. So
Absolutely.
that's a great point.
Oh, yeah, yeah. So I think we're going to see this continue to expand and to grow at a healthy rate, and the utilization will become a standard of the care continuum for all of us. And
So
certainly our kids going forward, they're going to know telemedicine as though it never wasn't a part of the picture.
right, as if it was always there, and that's what I wanted to ask you. Like, what do you think about going forward? Do you think it'll just become more of a staple? Do you think
Absolutely.
yeah.
Yeah, I think like so many things, you'll see the pendulum swing one way and go a little too far and then swing back and find its balance. Because it's certainly the kind of thing, it will never ever replace hands-on and face-to-face care. But it in the right position, it augments the care plan beautifully. So yeah, we'll see perhaps maybe a little overutilization if doctors get too comfortable with it, which we've seen before. But I think you'll see it come back to a real solid tool.
Yeah, find a happy medium, and
Yeah.
right, that's great. And with CMS moving so quickly to start utilizing it, when everything hopefully gets back to to normal, do you think they'll be just as quick to sort of try to shut it down, or do you think now that it's out there, it's
The doctors I work with believe that they will make a level-headed transition to just say, okay, you can do it, but please let's look at using something that's more HIPAA compliant and encrypted. I mean, like for example, the Zoom meetings where you hear about people that are Zoom bombing or whatever it is, where they get into the meeting and they're not supposed to be a part of it. On the traditional Zoom bots, I don't think that's going to happen. Or excuse me, I don't think that they'll continue to allow that to happen.
right?
But Zoom has been quick to move, and they have a Zoom medical model now as well. So folks can look at that.
Sure. Okay, so it's just something with a little bit more encryption.
I'd imagine, yeah.
Okay, all right. Well, it'll be interesting to watch, and I can't wait to see what happens.
Well, and I'll tell you what. Please also let folks know that we are through the COVID-19 crisis. We'll provide telemed free of charge to anyone who would like to have it done for their client. We simply need the doc to acknowledge that they'll do it, and we'll set both sides up.
That's awesome. Thanks, Jim. And Jim, I'll touch base with you after the call, and we'll get all your contact info, and we'll include it below so people can reach out to you if they have questions or they want to get set up.
Thanks, John.
Awesome. Thanks, Jim.
Take care.
Great talking with you. Thanks.